I want to talk a little bit about traumatic brain injury. And you're saying, oh, hey, that's an exciting topic. Let's talk about traumatic brain injury. I get it. It's not something that comes up in the normal course of dinner conversation. But it's actually quite common in America. And there has been much more attention focused on traumatic brain injury over the past few years, with the many returning veterans from Afghanistan and Iraq who have struggled with brain injuries due to the roadside bomb explosions. Traumatic brain injury is a very serious problem, actually, in America. Every year, 1.4 million people go to hospital emergency rooms with traumatic brain injuries from a car accident, falling out of a tree, falling off a bicycle. Now, 1.4 million people go to the hospital emergency rooms. Of those, 1.1 million are released without any further treatment. Because what happens when you go to the hospital with a traumatic brain injury is they do a CAT scan, an MRI, of your brain, which is an anatomical scan, which would show them if there was a fracture in the skull or a bleed, a hemorrhage on the brain. If they don't see a skull fracture, they don't see a hemorrhage, and you seem like you're doing okay, they'll release you. Unfortunately, those anatomical scans show absolutely nothing about the function of the brain. And what we're learning more and more as technology progresses is that brain function, it can be extraordinarily impaired from brain injury, and it changes your personality. And that really shouldn't come as a surprise to us. Every medical school student learns about a guy named Phineas Gage. Now, Phineas Gage is kind of a poster child for traumatic brain injury, and his story dates back to the 1840s. Phineas Gage worked for the railroad company, and his job was tamping down explosives with a 3-foot-long metal rod before they would blow the way for new train tracks. So he was the explosives tamper guy. And one time, he was tamping down the explosives and it ignited a spark, and it shot the 3-foot metal rod up through his head, under his cheekbone, through his eye, out the top of his brain, and took out a large portion of his prefrontal cortex. In fact, in my book, there's a picture of him holding that metal rod. And he's not a handsome fellow after the injury happened. But a couple of interesting things to note about Phineas Gage. We always think, well, someone has to lose consciousness for there to be a serious injury. Actually, after this rod went through his head, Phineas Gage never lost consciousness. In fact, he looked at his friend and said, "Did you see that?" Then he got up and walked to the nearest town to receive treatment. Of course, there wasn't a lot they could do except patch up his wounds. But the most remarkable thing about the Phineas Gage story is that his personality dramatically changed after this incident. Before then, he'd been kind of a model citizen, very affable, a great worker, always held a job. After this incident, he couldn't hold a job. He'd swear so much they wouldn't allow him to be around women. He became an alcoholic by all reports, and he spent the last 12 years of his life as a circus freak, going around the country holding his metal rod and telling the story of how he blew it through his head. So the fact that brain injury affects your personality, affects your mood, affects your life, because everything that affects your brain affects everything else in your life, really shouldn't be a surprise to us. It's been well documented throughout history. And especially that area of the brain that Phineas Gage damaged, which is called the prefrontal cortex. It is the most thoughtful, the most human part of our brain. It is the executive decision part of our brain. This is where we get our impulse control and our decision-making ability. No living creature has anything close to the prefrontal cortex function that we do. Chimpanzees are the closest to us. They have about 13% of the prefrontal cortex function. Dogs about 7%. And cats only about 3%. Cats are totally in the moment. If you have a cat, you know what I'm talking about. They're very distractible. I mean, they'll chase a little laser pointer light around a wall for hours and hours and feel really good about their life. They're totally in the moment. So whatever's going on, they'll do. If they're thirsty and the toilet's there, cat will take a drink out of the toilet. They don't care. So you really want to be careful when it comes to traumatic brain injury. And take a look. You know, did I fall out of a tree? Did I fall off my bicycle when I was a kid? Could that be a factor in the struggle that I'm having now? Because it's actually treatable. Unlike we once thought, you can actually rebuild some brain cells, and there are supplements, natural supplements, different kinds of foods, and even some medicines that you can take that can focus on the part of your brain that may be impaired. So you want to take a look, when you're looking at your biological history, your medical history, at your history with any kind of brain injury. It's important.